Hello, I'm Matt Roberts. Today we're treating a patient who originally presented with very small teeth and excessive gingival display. This treatment is being performed by Dr. Frankie Shull and myself. First step was to go through orthodontic treatment to get the teeth in a more favorable position. Once our orthodontics were done, we're ready for preparation design. A diagnostic wax-up was completed to do a mock-up in the mouth, and then Frankie did a prep-through technique. If we look carefully, we can see still cracks in the enamel, very conservative preparation there. Here's the diagnostic wax-up, and we see that we're not really showing anything through. The temporaries look nice, everything's looking pretty good, so we're ready to go to our final restorations. I'll do a wax injection from the provisional restoration model, and we'll start waxing. As I'm setting up the mesial and distal line angles here, incisal edge position, you can see the injection was very thin. This is a very conservative treatment. The teeth looked a little bit protrusive preoperatively, so we're moving them out to the facial by adding wax into the gingival third and setting up our line angles on our laterals, as well as filling our centrals in a little bit more there. The secret to success with thin restorations is evaluating underlying tooth color. In this case, the patient had very, very nice underlying tooth color. We thickened up the gingival a little bit here, again, more as a facial reflective angle issue than anything else. Embrasure form is still the most important part of aesthetics. You need to get nice, clean embrasures. I'm dialing in my surface morphology here with various carving instruments and a little bit of horizontal structure as well. We always want to check and make sure the position of our final restorations is where it should be. We want to make sure the length is where it should be. We go back and check our provisional models to determine this. We'll check our stick bite, make sure the midline is perpendicular to the stick, and we'll look at the photo of the stick, again, to be sure that we're working correctly. Here I'm going to separate the restorations into individual units. We'll go ahead and slice through with a very thin Tanaka blade. And then I'll take a little bit of the incisal edge back to leave room for translucency and do my facial cut back. We're working with lithium disilicate, Emax here, so I want to preserve as much of the 400 megapascal material as I can and use as little of the 80 megapascal layering material. So very conservative cut back technique. Once done with the waxing, we'll go ahead and invest the case. And then as soon as the investment sets, we put it in the burnout oven, go ahead and select our chosen ingots, and put it in the pressing oven. Once the pressing's complete, we'll go ahead and devest the restorations, take them out of the investment, and we'll be ready to go to work. We see the restorations now coming out of the oven hot. I want to make sure everything cools off thoroughly before we touch them or do anything with them as far as devesting goes. Once we recovered our restorations out of the investment, we'll start surface finishing and fitting. I'm establishing surface morphology here, just using a Brasseler's diamond. And then refining my cutback shape just a little bit with a diamond impregnated rubber wheel. We can see our initial shade. We have a tiny bit of a blush through from the underlying composite dye. We're at 3/10 mid-facial in that area. And if we look closer at a couple other spots, we find a place where we're only at 1/10 in the mid-facial area. So very, very conservatively prepped, very thin restorations. We'll use a little bit of staining to blend into the underlying root structure. We'll use a little bit of blue stain in the incisal to simulate translucency, and then we'll come back in with our layering strategy over the top of that. Here I'm using a blue-white incisal ceramic. Next to it I'll use a translucent blue. I'll finish my contact up again in blue-white. Using Opal OE1 to get the translucency on the distal. Once I have all of these lobes set up and established, we'll go ahead and encapsulate that incisal edge in either an OE1 or an incisal, and then we'll put mamelon effects in. I'll splay the brush and thin those mamelon effects out into little wispy, feathery looking structures. We can backlight the buildup and take a look at where the opacity differs here. We'll go ahead and fire that, and then we'll come back in and we'll start doing our next layer over the top of that. Here's the first bake firing showing the opal effects. Now we're going to full contour, and we'll separate that, and we'll do our final contouring here with the diamond. Coming back and doing a little bit of a correction bake, which isn't unusual. I usually miss it with my first full contour bake and have to come back and correct shape a little bit. Again, we'll come back and we'll redefine the shape of the teeth, looking at the provisional restorations, making sure we're staying on track. We can use a little diamond disc to work on our embrasures interproximally. Get those symmetrical. We'll recheck our stick bite again. We may even add a little corner when we go back and glaze. Here I'm checking the incisal matrix of the provisionals one more time, and just making a couple of final contour changes. We'll fit everything to a solid model, and then we'll go ahead and apply a final layer of glaze. We'll rubber wheel and diamond polish the surface, and we have our finished restorations fit to the solid model here in this photo, and a couple of photos of our happy patient when everything's all done.